All right, if you're in medical billing, you know this feeling, right? That frustrating moment when a claim gets denied. It can seriously feel like you're trying to solve a puzzle with half the pieces missing. But what if you had a decoder ring for the most common errors? Well, that's exactly what we're doing today. We're building a clear, actionable playbook for understanding and crushing those contractual obligation or CO denial codes. So, what's the number one reason claims get kicked back? You've probably asked this a million times. And look, while there are a lot of potential culprits, a huge chunk of them, they boil down to simple, totally preventable errors. And the payers tell us what those errors are through a specific set of codes. Learning to speak this language, that's your first step to getting more claims accepted, period. Okay, let's really get into this. CO codes aren't just random numbers an insurance company throws at you. No way. This is the specific language they use to communicate with you. They're telling you exactly what went wrong based on the contract your provider has with them. So you gotta stop thinking of them as a rejection and start seeing them for what they are, a set of instructions on exactly what you need to fix. So here's our game plan. We're gonna start by decoding the codes for procedure and modifier mismatches. Then we'll unpack all those tricky diagnosis and information errors. After that, we'll navigate the fun world of coverage and coordination problems. And to wrap it all up, we'll build your very own denial management playbook that you can start using like tomorrow. Let's do it. So, first up, let's tackle a group of denials that's all about the nitty-gritty of reporting services. These are the classic slip-ups, the mismatches between what the doctor actually did and how it got coded on that claim form. Let's break down CO4 and CO5. These are all about relationships between different parts of the claim. A CO4 denial basically means your modifier and procedure code are having a fight. Maybe you forgot a modifier for a procedure that needs one. With CO5, it's all about location, location, location. You can't bill for an inpatient surgery if the service happened in an outpatient clinic. The main thing here is making sure every piece of the claim is telling the same consistent story. You know, these next few codes really hammer home how much the basic details matter. A CO6 or a CO7 pops up when there's a clash between the patient's demographics and the service you billed for, like say building for a childhood vaccine for an 80-year-old. CO8 is the same idea, but it's about the provider. You wouldn't have a dermatologist billing for heart surgery, right? The big lesson is that the who, what, and where of your claim have to line up perfectly. All right, let's shift gears. Now we're going to talk about a whole other category of errors. And this time, the diagnosis code is the absolute anchor for the whole claim. If that diagnosis is off or the information supporting it is wrong, you can pretty much guarantee that claim is going to fail. You're starting to see a pattern here, right? Codes 9 through 12 are all screaming the same thing: inconsistency. This time, it's all centered on the diagnosis. A diagnosis for a newborn on an adult patient's claim? That's a CO9. A diagnosis that just doesn't justify the procedure performed? Hello, CO11. And the solution is always, always the same. You have to cross-check every single piece of information. Okay, CO13 and 14. These are almost funny if they weren't so frustrating. We're talking about impossible timelines here. These denials happen because of a simple typo that makes it look like you provided a service after a patient passed away, or even before they were born. It's a pretty stark reminder to double-check, triple-check every single date. And really, that's the core takeaway. In the world of medical billing, dates aren't just numbers on a form. They're critical pieces of the puzzle that build the timeline of a patient's story. Just one wrong digit can blow up the whole thing. So verify them, and then verify them again. Last two in this section, CO15 and 16. CO15 is a classic: no valid authorization, no payment. It's that simple. You got to make sure that pre-auth is not only done, but that it's entered correctly on the claim. Then you have CO16, which is kind of a catch-all for missing info. It's the payer basically saying, hey, you left something important out. Your job? Put on your detective hat, find that missing clue, and resubmit a complete claim. All right, we're heading into the home stretch. This last group of codes, this is where things get a little more complex. We're moving away from simple typos and getting into the weeds of insurance rules, payment agreements, and who's supposed to pay for what first. First up, a couple of super common administrative headaches. A CO18 is the system yelling, stop. We've already seen this one. You've submitted a duplicate claim. The fix? Always, always check the claim status before resubmitting. A CO22, on the other hand, is a coordination of benefits issue. It means you build the secondary insurance before the primary one. Simple fix? Find out who the primary payer is and send the claim to them first. Okay, now we're really digging into the contracts and the deadlines. A CO24 denial means the service is part of a capitation agreement. That's where the provider gets a flat fee per patient. You'll need to check your specific managed care contract for the rules on that. And then there's CO29, the one nobody wants to see. The timely filing deadline is passed. Every payer has a strict window, and if you miss it, you're going to need a really good reason and solid proof to have any hope of winning an appeal. CO45 is pretty black and white. You billed for more than the agreed upon rate in your contract. The fix is just as simple. Adjust the charge down to what the contract says. But CO50, this is one of the toughest ones to fight. This is the payer saying they don't think the service was medically necessary. To turn this one around, you need to arm yourself with compelling clinical documentation that proves the treatment was justified. Okay, so we've just gone through a ton of codes, but what's the point of knowing all this if you don't have a plan, right? So let's pull it all together into a simple, repeatable strategy you can use to manage any denial that lands on your desk. So, what does this look like in the real world? It's a simple 4-step playbook. Step 1, identify the CO code on the explanation of benefits. Step 2, diagnose the root cause. Is it a data issue, a contract issue, or a clinical one? Step 3, apply the specific fix we've been talking about. And finally, step 4, resubmit or appeal. You do this every single time, and suddenly, you're not just reacting to chaos, you've got a system. And look, let's be real about why this is so important. This isn't just about learning codes for fun. The real goal here is to reduce the number of denials you get in the first place, and to get claims paid faster and more efficiently. This stuff directly impacts the financial health of your entire organization. So, I'm going to leave you with this one question to think about. As we've seen, almost all of these denials are born from simple errors made right at the beginning. What if investing just 1 extra hour in prevention, in double-checking those details before a claim goes out the door, could save you 10 hours of chasing down denials on the back end? Because that right there is the real secret to winning the denial management game.